I'm J. Scott Bembry, MD. I'm an obstetrician gynecologist. I'm originally from a little town in North Florida. I ended up in this area because my stepdad was in the Air Force. I attended Wright State University for undergrad, and I also attended Wright State University for medical school. I did my specialty training at William Beaumont Army Medical Center in the Army in El Paso, Texas. I served in the Army for 4 years after that, and then came back to this area in 1999. Originally went to Xenia and then started practicing in Dayton. I had no plans of being a doctor when I was young. I mean, that decision came to me kind of abruptly when I was about 21 years old. It was just real clear to me that's what I needed to do. And at that time, I was going to go into family practice. And that's why I chose Wright State as the school that I attended. And but the summer between my first and second year med school, I spent 2 weeks with a woman who was doing a lot of OB and really liked OB. Just kind of caught my attention. And then my first rotation in med school was OB-GYN, and I just really liked it. And people kept saying, you seem to really have an affinity for this. You should consider doing it. And I resisted it. Like, no, that's not what I'm doing. I'm going to do family practice. And I kept on to that till like toward the end of my third year. And at the beginning of my fourth year, I went and did a rotation in gynecology where I actually ended up doing my residency. And first day there, it was just obvious to me because going to the operating room, I thought to myself, you go into family practice, you're not going to be doing this anymore. And it was just clear to me. This is what I'm supposed to do. That's how I've lived my life, just looking for what are you supposed to do? Okay, so it kind of chose me. I didn't really choose it. I can't imagine doing anything else. I did do some extra studies in menopause through the North American Menopausal Society. Dr. Watson and Lynn and I were the first OB-GYNs in this area to do Da Vinci, robot surgery. Been doing that since 2006. Just allows you to do things with the laparoscope that previous to that, you would have had to do an open procedure. You would have had to do a laparotomy. And it doesn't, I don't do that exclusively. There are people who do, that once the robot came along, that's all they would use. And it isn't necessary for every procedure, but it certainly allows me to do, say, a laparoscopic hysterectomy that traditionally would have been an abdominal hysterectomy. I see this when I go to appointments with my wife, or my wife goes to an appointment where, she's got issues that she's very concerned about. We're all concerned about it. And that look forward to that appointment, hoping to find an answer. And that appointment is a big deal to the patient. I mean, it's maybe 1 or 20 to 25 people I'm seeing that day, but that appointment is a big deal to that patient. And always remember that. That's my philosophy, I guess, too. I may not have the answer, but to be real straight about that also. To not give people the runaround. I don't know what's wrong with you. I don't know what's wrong with you. But here's what I think's wrong. Here's what I think we can do. And if I have really no idea, who can I send you to that might have the answer? Everybody deserves that.